Hey guys, Dr. FJ. If you're struggling with anxiety, you're struggling with some kind of tachycardia like a POTS or there's other tachycardias, gut issues, dizziness from positional changes, so some they call that like postural hypotension or orthostatic hypotension. So you go to move and your blood pressure drops and you get really dizzy for a while. And then what it could be is vagus nerve dysfunction. And there are a few reasons for that, but many times vagus nerve dysfunction can come from your head and neck being out of alignment. So head and neck go out of alignment, and they've shown on upright MRIs that can stretch the vagus nerve. They've seen the diameter get smaller, indicating that the nerve's being stretched. They say pinched nerve, it's almost never a pinched nerve, but a stretching of the nerve can happen. And the vagus nerve is parasympathetic to the heart, so typically they call it the rest digest kind of part of your autonomic nervous system. So that can slow the heart rate down. It also goes to the stomach, causes the stomach acid to be secreted. And when the stomach's not working right, sometimes that sends messages up the vagus nerve and it affects and can create anxiety. And then also with the blood pressure, the heart rate, that can be part of that hypotension that causes then the dizziness and the vertigo. So if you're dealing with those issues and no one really has any answers for you, so like some kind of tachycardia where your heart's racing, especially if it comes from changes in positioning, vertigo, dizziness with changes in positioning, gut issues, anxieties, and no one really has a good explanation, I would go to get checked, get x-rays by an upper cervical chiropractor, or some kind of imaging, but x-rays is usually the most common. Upright MRIs are few and far between and usually really expensive. So x-rays, get checked, because there's a really good chance, and a lot of these people suffer for years and years and years before they ever find an upper cervical chiropractor. So you or someone you know are having issues like that and you're not sure why, really good chance that your alignment is causing tension on the vagus nerve and it's not functioning properly. So get checked and see. And sometimes you see those happen after a whiplash injury or viral infections or both, and it aggravates and starts the vagus nerve dysfunction, and then you've got to get that alignment fixed or it'll never come right again.